Well, I'm glad you're healthy and safe. We can kick off. We have a few folks here. We'll gather some more as we go, and we can kind of do a check-in. Just so everyone knows, I'm Lauren Berson. We are here today for our webinar, Fertility Preparedness, Build Your Path to Parenthood. My role and who I am is I'm the founder and CEO of a company called Conceive. We're the first always-on connected care layer for fertility and pregnancy. We offer 24/7 texting, video chat, and phone support from our team of fertility and L&D nurses, plus peer coaches who've been in the shoes of the patient and really have that deep empathy. My focus on this problem and intention behind the company is deeply personal. I welcomed my daughter into the world after 3 challenging years filled with heartbreak, misinformation, and failed treatment, and Conceive is really the solution I wish I had. And I'm here with our partners, and I'm going to introduce each of them. I just want to kind of set the stage for what we're going to discuss. We're going to kickstart 2025 really like focusing on what it means to be prepared holistically. And sometimes we hear the word holistic and people say, oh, what does that mean? But really, we think about healthcare journeys as being not just the physical and the medical pieces that you need to go through, but your mindset and how you're feeling. Those 2 pieces together make up the whole of you. And that's really what we're going to dig in today. And we have 2 experts here to dig into both pieces. So while preparing for a fertility journey can feel overwhelming, like the right physical and emotional preparedness and readiness can make all the difference. So we're going to get into strategy. We'll start with insights from our panelists. I'll guide a discussion to address common questions, and we will always have open time for Q&A. So feel free to pop those into the chat. So that said, I am joined today by Dr. Taraneh Nazem, a double board certified reproductive endocrinologist and infertility specialist and obstetrician gynecologist at RMA of New York's West Side office. West Side. She is an assistant clinical professor of obstetrics, gynecology, and reproductive science at the Icahn School of Medicine at Mount Sinai, and our first medical advisor at Conceive. Welcome, Taraneh.
Thank you so much. What an intro.
I am.
I'm ready to mine now.
It wasn't. I know.
Oh, yours is going to go on for like an hour. We don't have time for that.
I know we don't have time for this.
You're too decorated.
I'm so thrilled to also be joined by Dr. Georgia Witkin, a clinical psychologist and expert on infertility, egg donation, egg freezing, and therapy for couples. She is the Director of Psychological Services and Wellness at RMA of New York and an assistant professor in the Department of Obstetrics, Gynecology, and Reproductive Science, as well as the Department of Psychiatry at Mount Sinai Medical Center. She is also the director of the Stress Research Program at the Mount Sinai School of Medicine. Welcome, Georgia.
Delighted.
This isn't even doing you justice. I mean, you've authored a bajillion books. There's so much more we can say, but let's dive in. I'm so thrilled to be here with both of you.
Needless to say, she's an expert.
Yeah, exactly. The expert.
An expert. Yeah. You can Google her later. Be sure to carve out an hour, but you'll be able to read through it.
Thank you.
So we're going to dive in and really talk first about maybe the physical readiness. Like, Taraneh, can we start with like, can you share a little bit about, I guess, how do you get your body ready for fertility? Like, what's important? Should you take 6 months to do a new diet and exercise regime? What should someone consider when deciding the right time to start their fertility journey?
Yeah, I think this is the perfect kickoff. And I think it's the thing that weighs on everybody as they're starting to think about it. And as a lot of women that I know, and as a woman myself, I sort of feel like it's something that's weighing on us for a long time before we're actually ready to start trying. So, it's, there isn't like one magical thing I can say, you absolutely do this and then you're going to have great fertility, but it is sort of like you said, a holistic approach to general wellness that is the best thing to promote your fertility. And so, thinking about that in advance can be very helpful, but I'm not going to give you a time frame that it has to be within X number of months before you're going to start trying. To be frank, it's something you should be doing in your entire life for yourself. But overall wellness promotes fertility. And when I say wellness, it means making sure if you have medical conditions that they're well controlled, that you're seeing your doctors, you're getting your checkups, you're taking your medications, you're doing whatever physical therapy you need or otherwise. That also goes for mental wellness. And I'm sure Georgia's going to talk about that. But, being in your best strength, both mentally and physically, is the best thing you can do before you embark on your reproductive journey. The other things people ask a lot about are sort of like lifestyle modifications. Do I need to change my diet?
Yes.
And exercise, vitamins, all that stuff. Well, all of that goes into wellness. If you're a little bit overweight or you're not at your target weight, that's something to work on, because we do see that being a little bit overweight or obese can impact your fertility. And so if it's something, and we know that also will affect your reproductive outcomes in the long term. So it is worthwhile to be working on your exercise. Now, you don't have to start training for a marathon, but slowly integrating it into a routine that you can keep up, that's going to give you good cardiovascular health and get you to your sort of like best, overall physical wellness. Same with your diet. I don't believe in fad diets. I don't believe in doing anything extreme. Figuring out a balanced way to incorporate all the food groups, do it in a way that you can keep it up long term, all through your pregnancy and beyond. And if you need to lose weight, and that's your goal as well, figuring out sort of a caloric intake or a moderation, like a modification to a diet, is the best way to do that in a balanced way. They typically say that the Mediterranean diet is the best diet for fertility, but it's just because it's balanced and has all the right food groups.
Yeah.
It's nothing that you have to strictly follow. I'd say just balance, no crazy extreme, diets and things like that. And then on the, beyond that, thinking about preparing and timing and vitamins and all of that, you don't need to take a huge vitamin cocktail to be ready for pregnancy. It does help to take a folate vitamin before you get pregnant, or if you want a prenatal vitamin, which can have more components than just folate, but you don't need to do this for a year in advance, even 3 to 6 months in advance. I mean, I'd say 3 months in advance is probably fine, unless you have a vitamin deficiency that you need to address in a separate way. And there is no perfect prenatal. Usually anything over the counter is fine. You do not need designer prenatals. Every prenatal has to have like a certain basic formulation. But I generally recommend picking something that is easy to digest. Some of them are huge and not too many doses, because some of them are like 4 pills a day, which is a lot. So trying to make things simple and easy. And then the last piece, and I'm sorry, I'm going on so long, but I know there's a lot here to unpack, but I'd say, if you haven't seen your menstrual cycle because you've been on birth control or you had irregular cycles or whatever, give yourself some lead time before you are ready to track it, see what's going on with your body, get a checkup with your doctor or a fertility specialist. There's no harm in doing advanced preparation, getting the knowledge, and just checking in with your body, not waiting until the deadline that now I want to start and my period's not coming. So those are my couple of quick points.
I love what you said. And I feel like, if anyone's listening, they were probably taking copious notes, because you really hit on all the aspects. And I want to pull on sort of 2 pieces. I think one of the things that you did such a great job of striking is sort of the balance here. And I think, and this is where it dovetails into Georgia and the emotional side, but one of the things about fertility is that it's so out of your control. And for years in high school sex ed, we learned that it was so easy. And I think now more than ever, people are realizing it can take time, and that's totally normal. And you can also find that there is an issue. And so I think what people are seeking, and I'll speak for myself, I was trying to find a problem and I was trying to control everything I could. So I was like, what's the exact cocktail of vitamins I should take? And what diet should I be on? I didn't actually go that far, but what exercise can I do and what's too much? And I was constantly feeling like I had all the information, but like not the right information, too much info, but not the right info at my fingertips. And I think a lot about the level of personalization that is so necessary, because I know, Taraneh, you're trying to strike this balance of sort of what's the least common denominator, but the reality is some of the answers can be really specific to you. And this feeling that you want to control things is such an important piece of the mental part of the journey, the emotional part of the journey. This is not just, hey, I'm just going to go have sex and time it with ovulation, right? There's so much more to it. Maybe you've always wanted to be a parent. Maybe you haven't, but you're ready. Georgia, maybe we can bring you in here. Like, what advice maybe do you have for individuals or couples who are just feeling overwhelmed, like at the start? How can they what are some like tactics they could take on?
Okay, so let's start with what we're looking at and why this is so stressful. You use the word control 7 times, I counted.
I
And
love
by the
that
way,
you counted
Taraneh,
that.
I'm very happy to tell you that I have worked on things and I am ready to become pregnant, which would be a miracle at not only my age, but lost my uterus 40 years ago.
I can make it
Anyway,
happen. That's the real miracle, but we're not doing that.
that would be a miracle. I've written 13 books on stress, 13 books. I will condense it into 1 sentence. I will save you money. You don't have to buy one single one of the books. When your sense of control goes down, stress goes up. And you kept talking about control. And that is the secret of human life. We are wired to worry, watch, wait, to relive, to see what the lessons are, to pre-live, to be ready for the future. If you think of the fertility journey, is there anything in life that triggers stress more than not knowing if it's going to work, not knowing why it didn't work, not knowing what's ahead? If you're going to become a parent, your sense of control is all the way down. So if we're worried, watching and waiting, the adrenaline is going to pour out and you're going to feel stressed, right? And the symptoms are what I call the 3 Ds and the 3 H's, just to help people remember. The 3 Ds, if you feel disorganized, if you feel decision-making problems, not big ones like who to vote for, but what should I have for lunch and it's already 4 p.m.
for lunch, yeah.
Or depression, not the kind where you can't eat and sleep, but the kind all you want to do is eat and sleep. And the 3 H's is hypervigilant, 1 car horn and you're already jumping. Hyperactive, your foot's going, your hand's going, because you have all this extra adrenaline that's meant for running from a bear, not months and months and months of IVF and fertility treatment. And the last one is hyperventilation, which sneaks up on us and suddenly we feel like we're having an anxiety attack, and it's just hyperventilation. So here's what I want you to know. Good news. Despite all of that, stress does not cause infertility. Stay off the internet.
Thank you for saying that.
Dr. Internet has it wrong. And it's blaming the victim. Aunt Fanny is saying, oh, if you just relax, you'll get pregnant.
Yeah.
You
Go on
tell
vacation.
Aunt Fanny that she'll be so happy to know that stress has nothing to do with it. And if stress was enough to make us infertile, there'd be no humans on the face of the earth.
Correct.
We don't get pregnant in the battlefield.
Famine and war, people can still
People get pregnant. Yeah.
And not only that, and you can swear to this also, Taraneh, if in fact some kind of stress, like running a marathon, does in fact, temporarily disrupt your menses, it's time limited and self-correcting. Nature wants reproduction. So if there's a problem, see a doctor. Candles are not going to do it. Deep breathing is not going to do it. Although, as you go through the journey, and we'll talk more about it, you'll need a lot of tools to be able to cope with all of the adrenaline and all of that sense of control that has dipped. But the one myth I would like you to start your journey knowing is a myth, is that there are no neat stages of recovery from stress or loss. Everyone knows about Kubler-Ross's stages. It was something that she saw in her office and her patients, but there's no research backing it up. And the truth is that what I've seen over my somewhat number of years doing this, can you keep a secret about how many years? No. Yeah, well, I can too, so I'm not going to mention it. Here's what I've seen. Everybody's different. Some people, in order to get their sense of control up, go right on to the next step. They say, whatever happened was information from my doctor. And what are we going to do next? So that's one way people handle. Others say, I need a timeout.
I need a break.
That's fine too. There is no right way, but here's what we've learned from COVID. I've learned this from being in this field forever. We are far more resilient than we think. And moving forward, since we're built for daily life, moving forward, taking control, seeing something that didn't work as more information, The shots, renaming them as inconvenient rather than a disaster.
Yeah.
Moving forward is the best way to stay resilient, to keep your sense of control. And I wish you a happy journey, and we'll talk more about it.
Yeah.
I want to chime in because Lauren's not going to say this, but I'm going to say it, which is that the number one reason why, as soon as I met Lauren and heard about her idea for Conceive, I was on board, is because what she provides with Conceive is exactly what everybody needs. And it's a little something different for everyone, because not every person is the same and everyone has a different need. But the one thing that everyone has in common is everyone can benefit from some support. And Conceive provides support in so many different ways. And it depends on being honest with yourself on what it is that's going to help you in the process. And it doesn't matter where you are. You might be a year away from trying to conceive.
Yeah.
And you want to kind of learn about things and dip your toe in slowly so that you don't have to be down to the wire. You may be a planner, or maybe you don't want to know anything until you're kind of in the thick of things and things aren't going well and you need support in a community environment. Or maybe it's that you just need information about what the hell is going on and what is my doctor talking about? Or you need an advocate or a coach or whatever.
Yes.
Conceive is providing all these things. And, it was amazing when Lauren came to me and talked to me about this. And I was like, wow, I hadn't even realized until I talked to you that this is a huge gap in our industry. And it's like, why are we not already doing this? But it is remarkable the kind of impact that it can have. And so it's like, I'm saying this not just to promote Conceive, but to say to all of you, figure out, be honest with yourself about what it is that's going to help you. And maybe privacy is what you want and you don't want to talk about it, or maybe talking about it's going to help, or finding information is going to help. So that's why RMA and Conceive are joining forces, because it's more than just one ingredient in this recipe.
I'm going to add to that. Lauren, you'll just listen.
Okay.
In a 4-month trial with Conceive, we had more than 3,000 messages from our patients to the people at Conceive asking questions, because you can't call your doctor in the middle of the night, but you can call Conceive. And everything sounds more comforting when you say it out loud than when you think it alone at home in bed in the middle of the night. There were people who averaged 68 calls to Conceive, and it's fine. Here's what I want to tell you professionally. Everyone says talk, communicate and talk. As Taraneh was saying, some people don't want to, some do.
Right.
But here's what we know about therapy. The use that you make of therapy depends on what the therapist says that you can say to yourself. That's what a therapist is doing. And that's what the Conceive group is doing as well. You get a chance to hear yourself out loud. You not only get answers, but that's what you can say to yourself. Okay, I asked about that and I heard that, because the truth is that just talking is not good enough. Not anybody will do. You have to talk to either somebody who really knows what you're going through, or they've been through it themselves. And honestly, when you're asking the question, you don't want to hear about their journey. They don't have to prove what they went through. But we know from Lauren, they have been through it. They have been trained. So it's not just talking. It's really talking to somebody where when they say, I understand, you don't say to yourself, baloney. You say,
that's exactly right.
Yeah.
I have the
when I talk to patients, I don't know that they believe me sometimes when I say things, but if they hear it, it can see. It feels like, oh, okay, maybe she wasn't talking nonsense.
You two are the two best advocates for Conceive ever.
We're not even letting you moderate this session.
I know, I love this for me.
This is all free.
This is a takeover.
But what I will say is, like, so first of all, there's so much wisdom here, and it's like hard to even unpack all of that. But what I will say is, like sitting as the patient, right? I've been a fertility patient for 7 years in different machinations. Like, it's exactly what you hit on. And this theme of sort of personalization keeps coming up, where it's like, it's not one size fits all. And yet when you're Googling around or you're talking to the neighbor's friend who's also going through it, they have a very particular journey. And I think that's really what it's about. And when you're able to answer a question in an evidence-based way within 5 minutes, instead of playing phone tag with your doctor's office for something more simple, like, can I have a glass of wine, which you want to know the answer to, right? By the way, it just changes that sense of control. And I love the 3 H's and the 3 D's. It's such a great framework to break down and understand, sort of check in where you're at. So let's stick on this a little bit, and let's talk a little bit about, like, how can patients better prepare for conversations with their doctors? So let's say, okay, we started with like the getting started part. Now let's talk about, like, how do you prepare? And let's start with maybe Taraneh and then go to Georgia. Like, what are the things that they should do to make the most of the appointments? Because I know as a patient, no doctor has enough time in the world, like just none. We'll just take that out. And there are lots of times where you feel like, oh my God, I'm just learning this and I'm processing it. And I may have come up with a list of 5 questions, but I get like nervous and awkward. And this happens to men and women universally. And you let that slip away. So what are some things folks can do to better prepare?
This is a little bit tough because it's a little hard to know. It sort of depends on where you're at, right?
What it is.
And
Yeah.
Is
Yeah.
it your first meeting with the doctor, or are you like 6 to 10 meetings in and having trouble on something? I'd say, I'd like to pretend that you don't need to do anything and the doctor should guide you, but that's not the reality of life. And so if you have specific things that in a calm environment in advance of the appointment, you need to address and it would help you, make a list. It's okay. Don't ever be embarrassed. That is your time and it is your prerogative to ask the questions that are in your mind. And it is true. A lot of people clam up or freeze once they're in that moment because they feel like they shouldn't be asking, or they're not supposed to be advocating for yourself. Advocate for yourself and say, I have a list of questions. Can I go through it? And hit every single one. Do not be embarrassed or hold back. And you know what? If you didn't hit every single one at the end of the visit, make a follow-up, make your list, update it, and do it again. You deserve it. It's your time. And if that's going to help you keep on track, keep on track. Or bring somebody with you who supports you, who makes you feel comfortable, who also knows your list or is sort of privy to what's on your mind and will help you if you sort of freeze, and that's okay. And like I said, always feel free to say, can we have a phone call? Ask about how you can communicate. Is it through my chart? Is there an email? Is there a way to set follow-up?
Yes.
How do I do that? What is my back and forth? Is there other support in the clinic beyond you that can answer some of my questions? Like, for example, I work with a team of people who are all incredible and help me to make sure that every single patient's questions are answered and that they know what's going on in their cycle. And we're not perfect. Like, it doesn't always go perfectly. And that's okay. I think I have to be honest about that, but that we are, and we've enlisted Conceive to help us do it better as well. But, maybe the nurse can answer some of the questions that are on your mind and you'll have more time with that person later, or a point of contact with her, or a coordinator or a financial person or whatever. That's, I think, it's hard to know until you're sitting in the room, but the more you prepare in advance, the better. You do not need to do a ton of internet research before you walk into a doctor's office. It is a responsibility of the doctor to educate you on the things that they're talking about. But if you feel during your visit, you're not jiving with that person, you're not getting the information you need, that it wasn't the right place for you, it's also okay to find another doctor or another clinic. And I tell this to patients all the time. And when we do webinars and stuff with Conceive, that like, you're not locked in just because you had an appointment, and you're not breaking up with somebody if you don't come back to them. You have to figure out that there's good chemistry as well as good clinical skill in the place that you end up doing your treatments with.
That's right. Those two things go hand in hand. I think that's so important that you are the only one that knows your body. And so you really do need to get the questions answered and find the right resource for that. Georgia, anything you wanted to add?
First of all, I think, Taraneh, you should be double boarded in psychiatry because those are the 3 points. Great. If you have a minute or two, I have 83 columns in Psychology Today called Chronicles of Infertility. And I really echo everything you're saying. Here's what I would add. You are a consumer. Walk in understanding that you are a consumer. This is technology that you want and need. You're going to be paying for it, whether it's reimbursed or not. And that's empowering. You don't feel like you're back in kindergarten and the doctor is the teacher and you have to be good or they won't like you and they won't pick up the phone. You are the consumer. This is your journey. That's number 1. You're entitled to be honest about who you are. And if you're somebody who's nervous about all of this, let the doctor know. If you're somebody who likes real research and you want to know the science, let the doctor know. If you're somebody who wants to look at every step as getting you more information, whether it worked or not, let the doctor know. And as Taraneh is saying, and so is Lauren, you'll very quickly know if this is the right match for you, because you are in charge, not of the treatment plan, but of choosing this center, this doctor.
Yeah, it's hard. It's a hard balance when it comes to fertility, because the clinic that you choose also matters. You need a place that can give you the results. And not a lot of people know, when it comes down to IVF, that actually the metrics really matter. It's like choosing a good surgeon or not. Your foot surgery is going to come out good or not. You know, that stuff does matter, but you're also entitled to have an experience where you feel respected and heard, and that you feel comfortable. I think it's not a good idea for you to ignore the other half of the equation, but it is important that you find both things somewhere. And you know, like, I hope it'll be in a reputable clinic, but, you know, you don't want to make a big sacrifice on your clinical side either. But I totally support what Georgia
I would actually say clinical side is primary, and within the clinical side,
find someone you're comfortable.
Make sure you're comfortable, because you've chosen this clinic.
Key. Yeah. You're a consumer. That is such a brilliant way of reframing. I think what's unique in fertility, for worse, not for better, is that it tends to be out-of-pocket expense because there's not a lot of coverage. There's not universal coverage. And so people do feel a little bit more like, oh, I can select things. Okay, but they still don't feel like comfortable enough to sort of speak up in certain ways that are really important. And things can get missed, and everyone is human, and you're the only one that knows you. I love the notion also, we're dovetailing a little bit into the territory of like, how do I find the right clinic? And I think there's a few factors that you touched on, right? First and foremost, does someone take your insurance if you have coverage? That's one thing to look at. And that's not the only thing. Importantly, as Taraneh and Georgia mentioned, is the quality of the clinic and the lab, right? We think a lot about the doctor and the nurse teams that we're going to interface with. We don't think a lot about what happens in the lab if you're doing IVF and treatments like that. And that's really critical. And so there are results in SART and all these different databases that you can pull to really understand whether that clinic is reputable or not. And if they're doing lots of cycles and have a lot of experience under their belt, then it's the communication with the doctor. You know, how often do you see them? Do you care? Is it okay if you see them the first appointment and that's it? As long as you feel nurtured throughout the way. Is it a big clinic? Is it a small clinic? How do they communicate? Is it via text? Is it via phone call? Is it via portal? These are all the kinds of things that you might want to weigh. And things, you know, folks could like us.
And it increases your sense of control.
That's exactly right.
What you need to know. And you know what I'll say, and I'm sure Georgia will chime in on this. I think no matter what the format is, if you know about it in advance, you can be prepared and be a part of it. And you don't know what your needs are really until you go through it. But if you know kind of what to expect, it's a lot easier than you know, walking in kind of blind, expecting that you're going to get a call from the doctor every single day or see them at every single appointment.
And never see them again.
Never see them. So it's better if you just ask up front, what is the format here? How does
this work?
And I'll say typically in most doctor's office, but particularly in the fertility sphere, you're not going to see your doctor all the time, no matter where you go, unless you're in a single person provider practice, which is kind of a dying art. And so I think being prepared for that is better than, you know, the alternative, but find one that has the balance that feels comfortable to you, because it's not all equal across the board. There are some places where you'll get more one-on-one with your doctor than others.
So let me chime in this way.
Yes.
Many of us remember when you walked into a doctor's office and they knew you probably most of your life. And the nurse says hi because she knows you and how's your dog doing. And I, you know, knew it was at the vet. And they call the pharmacy and the pharmacy says, oh, you're not doing penicillin because we know that George is allergic. That's gone, as you said. And that's what I love about Conceive. The first thing I thought of when Lauren was talking to me about Conceive is we are bringing back what we always wanted, which is to feel comfortable being able to make a call. I have patients who say, well, I didn't call you, doctor, because I didn't want to bother you.
I didn't want to bother
me. And then you know that there's all this distance and fear and so forth. And it's like, no, here's my home number. Here's my text number. Yes, I'll give it to everybody at the end of this session. That is what I think Conceive does. And it does change things. It's not concierge, because that means it's the new way, but we're trying to make things better. It's the old way. You get to talk to people.
I love that framing too. My goodness. Can I hire you both for marketing? I think, you know, the thing that strikes me there is again, we're going back to that one-to-one relationship and looking at how can you create that experience? And one of the things that guides us is, how do you make someone feel like they just got a hug, even in the hardest of moments, right? And that's, you know, and to your point, Georgia, even though our coaches have been through fertility, all different kinds of fertility journeys, they're often not going to say, oh, I did that too, right? They're just there to listen. And you know that they have that deep level of empathy and compassion. And maybe this is a good segue then to, you know, we do not provide therapy. I've been in and out of therapy my whole adult life. I'm a big advocate. I've probably been in more than I've been out. Georgia, talk to us a little bit about, you know, what role a therapist can provide. What kinds of therapists should folks look for if they feel like they need extra help? Yeah, walk us through that a little bit.
Again, you are the consumer. What I was saying happens in doctor's office, happens in therapist's office too, where you sit there and you feel like, oh, I don't know if I'm getting anything out of this, but that's the therapist. It must be right. There must be something wrong with me. So I'm here to tell you that, again, the most important thing you're going to get out of therapy is the therapist saying things after listening to you that you can say to yourself. So if you're not walking out able to comfort yourself from what you've heard from a therapist, then it's not going to help you on your journey. So the good news is, as I said, the people are very resilient. And when it comes to fertility journeys, it happens that most people who sign on for some therapy because the stress is interfering with their daily life. And if you ask me what the sign is that you should look for help, we're built for daily life. So if it's your relationships that are suffering, if it's your work that's suffering, if it's your fun that's suffering, if time to see somebody so you can go on with your daily life. That's what we're built for. And moving forward, as I said, is how you are resilient. There are no neat stages that we're locked into. So if you see daily life interfered with, look for a therapist. There was a recent study of what kind of therapy works. And there were 12 different types of therapy that train therapists specifically in the fertility area. So I'd say, number one, find a national organization or a state organization like AP, American Psychiatric, American Psychological. Call Resolve, which is specifically for support in infertility. Call ASRM, the American Society of Reproductive Medicine, and get referrals to people who do specifically that. I think even Psychology Today has a whole section on therapists. Find someone who's familiar with this area. And in general, the umbrella is cognitive behavioral therapy. If you're going through therapy, if you're going through a journey, a fertility journey, discussing whether your mother breastfed you or not is not the most useful part of a session. It really should be directed at, you know, where is the problem right now? What is making you anxious? What would help make you better? How about your relationships? So you need a therapist who will talk as well as listen, and you will have takeaways. Most who go into therapy during fertility treatment find that 3 to 7 sessions is enough. So don't think you're signing on for life. That could be a different kind of therapy. Call Lauren and she'll give you tips on that. This is specific to what you're going through right now.
I love that. And I think it's such an important differentiator, because I think when someone says, oh, find a therapist, it's like, okay, well, where the hell do I start? Excuse my language. And also, by the way, there's a ton of therapists that practice psychodynamic psychotherapy. And that's a very different kind of therapy, which you may need. It's not that you wouldn't, but you should know that's a lot more long-term. It's not, it's oriented around your childhood and things like that. And I'm not an expert. I'm only an expert as a patient. I've been in both. But sometimes you just want frameworks for like, okay, so what, right? So what do I do now?
So how do I handle the not knowing? How do I handle the wait until I get the results? That's
exactly. Exactly. The awareness is one thing, but like the tactical steps is another.
I
Let's
think
talk.
it's so important just to say
Yeah.
though, that there are, what's kind of interesting is that I feel that a lot of people maybe don't know as much about their health until they come through fertility stuff.
Yes.
This is sometimes their first interface with a health problem that they've
Yes.
really dealt with before. And so
Totally.
both things might be necessary. You might need just some help with getting through this sort of crisis mode, and maybe some short-term therapy that's targeted to reproductive health will be helpful for you. But it's also a time where I find a lot of people are discovering they had mental health underlying things that they didn't know and didn't address.
Yeah.
And it's an opportunity when you are plugged into the healthcare system to get the recommendations, to find somebody and initiate maybe long-term care that you otherwise may have been able to get away without addressing, but now
Yeah.
stress is just too high, and there's more there than just fertility stuff. So I find it also with like, I often diagnose people with medical problems they didn't know they had, and that could be like even diabetes, because they haven't
Yeah.
been seeing doctors because they've been young and fine and didn't feel that there was an issue. And now is the first time they're really addressing their health. So it goes with mental health too. So I just say, don't write anything off, be open, and you never know, what kind of benefits will come out of having going through this experience.
I think that's such an important piece. And I'm glad you mentioned that. And I do think, I mean, I know for me, I was lucky enough to not have had a major interaction with the healthcare system until my infertility journey. And so there was a lot I learned through that. Let's talk tactical for a second and keep on that theme. And maybe Taraneh, can you walk us through kind of medication protocols? Like we talked a lot about personalization, how they're different for patients. Like how do the protocols, like how do you come up with them? It's not some magic 8 ball in a sorcerer's room. Sorry, too much magic in my house these days.
Just the pin the tail on the donkey kind of
Yeah,
thing.
you're like eeny, meeny, miny, moe.
Well, so I'll take one step back, which is that not all fertility treatment is created equal, and it's not all IVF.
Correct.
There is the ability to walk into my office and walk out and not do any treatment. It could just start with a simple checkup. It could be just getting in touch with some of the, hormones that are going on in your body. Maybe you need to address a thyroid problem, things like that. It could be that you're coming to me and maybe you just need help with figuring out your cycles and tracking that. Maybe you have irregular cycles and you need some medication for that. Maybe you have a male factor going on and you need inseminations for that. Maybe you have no fertility issue, but you have an access problem because you're a same-sex female or same-sex male couple, and you just need access to care for different reasons. But maybe you need something like IVF. And when it comes down to IVF, the protocols are very personalized to whatever your specific needs are. It has to do with your, after taking extensive medical history and doing diagnostics and figuring out what, kind of we're aiming for. A lot of it comes down to what is the quantity of your eggs. And if you've done any IVF in the past, how you've responded and incorporating your response to treatment into new cycles, et cetera, et cetera. There are protocols that are specifically designed for somebody who has a low egg reserve or has
Right.
a poor response in the past and whatnot. And figuring out which is the right one that's where sort of the art of things is. It's not like something I can just tell you, this is the algorithm and you plug it in.
Of course.
And
Yeah.
that's where I think experience comes into play, and where it is important not only to jive with your doctor in a sort of chemistry way, but also know that your doctor is comfortable treating multiple different kinds of things over, some kind of experience. So, I mean, I don't know how deep you want me to dive into it, but I'd say that it is nuanced depending if you have a really high reserve, there's a
Right.
specific protocol for that. If you have a really low reserve, there's specific protocols for that. And there's a whole bunch of stuff in between that, you can always ask your doctor, why did you choose that protocol? Or would you consider this or consider that? I have people ask me that all the time.
I think that's very helpful, and it dovetails nicely into our first question from the audience. And if you're listening in, please ask us questions, put it in the Q&A box. An anonymous attendee asked, until what age are women usually fertile? I'm 33, turning 34, in about a month or so, never had children. I have a lot to say here, but I'm not the doctor. So Taraneh, go ahead.
Okay, well, we'll do the fertility 101 real quick, which is that, so the way that the sort of biologic clock in female reproductive biology works is kind of fascinating in that we are born with all of our eggs, and we're losing eggs from the moment we're born, even before we're born, all the way through until we get to menopause.
Isn't that wild? Every
Yeah,
time I think
very
about
wild.
that, I'm like,
But
it's
as
wild.
much as it sounds like it doesn't make sense, it does make sense. And the reason is because it's not safe for a woman to get pregnant in her 80s. And so this is nature's way of protecting. What are you saying that for, Jordan? Of protecting the safety and health of a woman. Now, what we have learned and overcome in more recent years is that there is more of a window to safely carry a pregnancy than our ovaries will allow. And our ovaries really are the biologic clock that, there comes a point at which we stop ovulating, and that's what menopause is. But there's also a point at which the eggs that we're ovulating stop having the quality that we need in order to have a successful, healthy pregnancy. And it is a little bit different for everybody, but the general rule is that fertility starts to really decrease after the age of 40, but it starts more rapidly decreasing, from, I guess I'm not saying this very well, but pretty much fertility is pretty smooth sailing for a long time until about the age of 35, and it's not a cliff that you fall off of, that things start speeding up so that by the time you get in your 40s, things are really like tapering down in terms of your fertility. So it has to do not just with the quantity of the eggs, but the quality of the eggs. The quality of the eggs is actually probably the most important component to female reproductive biology. All bets are not off after you turn 35 or even after you turn 40, but there are a lot more challenges after those ages. What's remarkable with the technology that we have through IVF is that we do have the ability to get a woman in her 40s pregnant. Sometimes it's with her own eggs. Sometimes it's with younger eggs, either from her that she froze before or from a donor. Because, like I said, the uterus and the body can hold and carry a pregnancy safely up until about the age of 50, but your body can't necessarily produce that pregnancy safely or easily after the age of about 42 to 44. It gets really, really hard after 44. But I would say that to the person who asked this question, you are young. Expectation is at your age that the majority of your eggs are good quality, and that puts you in a strong position to be able to conceive. You should still have a few good years of,
Yes.
conception. You will hear stories about people who have no difficulty getting pregnant in their late 30s and early 40s, but I want you to know that that's the exception to the rule and not the rule. And so, if you have more specific questions about your reproductive planning, it's a good idea to maybe speak with somebody.
Yes, and you don't need like a referral or anything to see a reproductive endocrinologist. You can just get tested. And I'll also just add a couple things. As a 42-year-old who has one daughter, took us forever to have her, and then did IVF the second time around, we do have 2 frozen embryos that we may or may not try and use. There's a lot of baggage there that I will not bore everyone with. But the beautiful thing, and I love the note that you ended on, Taraneh, is that if I wanted to carry this child, I could implant and still have success late into my 40s because they're 39-year-old embryos. So they're a little bit younger than me. And I think the other thing I wanted to make sure we touched on is that there is no test for egg quality. So anyone that tells you they can improve your egg quality, there's no metric to actually measure that. Obviously, when you do, or not obviously, but when you do things like IVF, we can test by we, I mean like embryologists can test embryo quality and give you an understanding of where you're at from that perspective. And of course, sperm quality is the number one thing I talk about. Do it as soon as you're thinking about trying to conceive. It's cheap, easy, and pleasurable for a man to do it. And did you know you could not have sperm in your semen and never know it until you get it tested? So get tested.
Yeah. I think that's a distinction, though, that eggs quality cannot be tested. And it's frustrating, I'll tell you, in my
really
perspective, it is
frustrating.
the most important thing when it comes to conception.
Yeah.
And that is your biologic clock. And
Yeah.
it's amazing. The uterus can hold a pregnancy so much longer than the ovaries can produce it. And so that's where fertility preservation comes into play. That's what egg freezing and embryo banking
Yes.
is all about. If you're not
Yes.
about your reproductive future, maybe you don't even know if you want to be a parent, but you just want to have options, you want to buy yourself time, that's what that's about. And what's very cool, yeah, is that the eggs and embryos, once they're on ice, they remain whatever age you froze them at,
Yes.
remain that
Yes.
age the whole time they're on ice. So you can have like a 32-year-old pregnancy when you're 42 if you want.
Yeah.
Uh,
Yeah.
but I mean, it just takes a little forward planning.
Yeah.
If only we could do that with the face. But I want to add something.
Yeah.
Put
Yeah,
it on
please.
ice for 10 years.
Georgia,
Here's
I
what I
love it.
wanted to add. I was in the Department of Psychiatry and I was writing about women and stress. And when they started the fertility unit at Sinai, they said, let's get that woman who writes about women and stress to head up the psych services for fertility, because obviously our patients are women. And I just want to make sure everybody listening knows that when you look at fertility journeys, we now, though, it's 50-50. And we don't
50-50.
even think that way half the time. And as Taraneh was saying, until you get tested, you don't even know if there's a male factor as well as the
Correct.
female factor, if it's
Right.
both, if it's one, if it's the other. So if you have a partner, you're in it together. If it's a male, female, if it's two males, then you're definitely in it together. But we're not just talking about women.
Oh, it's so
Absolutely. And it's
important.
amazing, you know, somebody will come to me and they'll say, well, I have irregular cycles, so that's clearly the problem. And then we do
Right.
testing and we find there's also a second thing going on.
Yeah.
And so it's just, you know, and I am very, very committed to, we need to do the whole workup before we start treating things, because so many times this comes up and it's not fair to just do this with blinders on. So
No, yeah.
absolutely go and get the full checkup, and it takes two to tango here. So we need to get everybody involved.
And so many times I've seen patients the women go through lots of poking and prodding only to find out way late what a $200 or covered by insurance at-home test could do for you. So there's really no reason to not start there. Of course, there's stigma and shame and things to unpack from an emotional perspective, but I highly encourage men to get checked out immediately as soon as they're thinking about it, or just if they're curious. We have a couple other questions and we have a little bit more time here. So if there are folks that want to ask questions, feel free to pop them into the chat. There is a question on egg quality. We talked about this. You can't measure egg quality, but someone's asking, are there guidelines for maintaining or improving egg quality? And I guess
This is the hardest part about my job.
Can't, yeah.
Frustration. And I hope in the next decade that we're going to figure out ways. But the bottom line is that there isn't any kind of specific, clear, evidence-based treatment that improves egg quality. I wish there were. There's a lot of experimental stuff out there. There's a lot of studies that suggest things. And the reason we don't have it is a couple of different things. And one is that some of these things are hard to study. So the studies that are kind of neither here nor there suggest that maybe there's certain vitamins that'll help with egg quality. We know it doesn't harm egg quality, but we're not certain it absolutely promotes it. But
yeah.
you know, there are vitamins that you could explore if you really wanted to. Same with acupuncture, a hard thing to study, hard to suss out. How does acupuncture directly affect egg quality or fertility outcomes, et cetera? But again, no downside, and there is a potential for upside. And that's kind of where the data is. It's a little murky, but it's, as long as it's not harmful, I'm all for it. Now, there are other more experimental things like PRP for the ovaries and a growth hormone and all this stuff. That has no evidence and has the potential for downside and risk. So I wouldn't bark up that tree. And it's not something I practice because I don't believe that it's risk-free and safe. The reason we don't have the like sort of fountain of youth of our ovaries is that since the egg has been in your body your entire life, you can imagine all the damages it goes through. I mean, Georgia was joking about your face, but it's the same thing. You know, we get wrinkles, we get sunspots, all that same damage is happening to your ovaries. And the egg does not have the ability to self-correct damages. It just doesn't have that cellular mechanism. So unfortunately, we're kind of stuck with what we've got. And that's why age is the #1 determining factor in terms of your reproductive success, because the younger you are, the better quality your eggs are going to be. Every so often, there's somebody who's young who has poor egg quality, but it's rare. And that's why, you know, everybody's always like saying, you know, start young, but
Or someone who's older who has good egg quality, can get pregnant easily
There's
in
always
their
an
40s.
exception to the rule.
Yeah, it's really.
I want to add to that.
Yes, please do.
Absolutely echo it, but I want to add to it from the psych side. If you look at Dr. Google, you really hear advocates for everything from gratitude to mindfulness as really enhancing because, you set up the right vibes and so forth. I am all for exercising to burn up the adrenaline, do anything rhythmic because you know what's coming next, play, laugh because oxytocin and endorphins are coming out, all to help you on your journey. By being hopeful, you cannot jinx things. I also know people who are afraid to be hopeful because you can't. I endorse it all, but be clear. I'm not endorsing it because it's going to change egg or sperm quality.
Yes.
And don't believe that. There's no hard data to back that up. But it is all being good to yourself, giving yourself permission to take breaks, and treating yourself as a loved one is how you get through the journey, but not how you
I
change
always
eggs
say
and
the
sperm.
same thing. Oh God, that was the best thing you said. And I absolutely believe that also don't drive yourself nuts and go get super stressed over these things that also don't have the evidence behind them. I tell people all the time, if you're interested and want to do acupuncture, go ahead and do it. But if it's going to
If it
stress
makes
you
you
out,
feel good,
have that appointment,
exactly.
to have to pay for it, to squeeze it into your day and whatever, and you're just, it's like tense over it. Well,
That's exactly right.
helpful.
If
Not
it's
that
another
going,
thing on
your
your
stress is
list,
going to mess up your fertility, but why should a treatment
don't
like
stress
that
yourself out. Yeah.
make you feel miserable? So it's about balance and doing what you think is going to work well for you, because we don't have the fountain of youth, unfortunately.
And as Lauren says, we don't have control. It's also an attempt to take control.
You
If
have the
I do
control to
this,
cancel that
then
appointment.
will happen.
You can
And
cancel that appointment and go get a foot massage instead if that's what you want.
Right.
Like,
Well, what you're hitting on is the person, again, it comes down to personalization. I hate to keep, saying it, but the reality is it's so true. It's like one size does not fit all. If acupuncture calms you and it's a nice 1 hour a week or half an hour a week for you, go do it. And there is a balance of evidence-informed. I call it evidence-informed versus evidence-based, because we don't have enough randomized control trials, which are the holy grail in science, to definitively say acupuncture is going to get you pregnant. But does it make you feel good? Great, then go for it. And it's really this balancing act. Does taking 20 supplements make you feel like you have more control? Well, let's talk through them and make sure nothing is dangerous, and that, you're looking at some good brands that don't have extra plastics in them or things like that. And so that's really where the rubber meets the road, and I think is a critical piece. We have one more attendee question, but before we get to that, I do want to hit on, we were talking a little bit about men and women. It takes two to tango. Even if you're in a same-sex couple, right, you'll need to get sperm donor, egg donor, etc. But when you are partnered up, let's talk a little bit about how partners or loved ones can best support someone going through fertility treatments, right? We talked a little bit about getting tested, and that's key. But like, what else, Georgia, maybe we can suggest to folks? Because that's a really tricky piece. I know with my husband and I, he's an amazing supporter, but it got tricky when we had our miscarriage. We were not kind of grieving the same way.
Right. And I've done a lot of columns on it and, written books about it. So I've really, really looked at the research, and whether it is nature or nurture, male and female styles are often different, not always, and sometimes there's a misunderstanding. And what I hear from patients the most is that if the journey involves the woman taking hormones and really going through all kinds of procedures and losses, her partner wants to fix it, which is lovely. Yeah. And coming from the goodness of his heart.
Yes.
And typically she's saying, don't try, you can't fix it, stop trying to fix it, ask me. So that's my word of advice to partners, male or female. If your partner is particularly stressed or anxious or sad, ask them how you can help.
Yeah.
Be there. If you are there and they want to talk, the advantage is they get to hear themselves. And they might be saying, I can't even do this one more time. And once they hear themselves say it, they might say, well, maybe one more time. So I'm saying to partners, half the time, you don't even have to say anything, but you do have to be there and ask, how can I help? And your partner will tell you most of the time.
They will, right? It's
Yeah. What would you say, Lauren?
like, yeah, there's something there of like, do you need a hug? Do you need me to just listen, or do you want me to help you come up with a solution? Right there, I think
Or
there's
leave
some
you
acronym
alone.
in there.
Or
Or
you want me to leave
or
you
just
alone tonight?
F off. Totally. Like, let you binge Netflix or whatever's going to make you feel good, get you some ice cream and let you be.
Somebody
But I think
once
that's an
said, this is
important
probably
piece
like
for anyone.
not cool to say, but somebody once told me this. I thought it was so funny. Like, they would say with their, like, in a couple, like, so do you need a screwdriver or do you need a screwdriver? Like, do you need the drink?
A
Do you
cocktail
need
or
the actual screwdriver? Or do you want me to
solution?
fix the problem? Like,
That's
what
a
is it
nice
that you
one.
want from tonight? Like, do you just want to vent, or do you want to
Right.
like
And I think
actually
that
problem
goes
solve
to
together?
any relationship,
I
right?
mean,
It's
I
not
think
just
that's actually,
this.
it's
Yeah.
nice. I mean, it's sort of like, let's be real. What is it that you want? What can
Yeah.
to make you feel good? And like,
How can I be the most supportive?
want me to just listen and you just
She or he might not even know.
Yeah,
Yeah,
exactly.
yeah.
No one even knows. Sometimes you just want to cry. Sometimes you just want to
Yeah.
not think about it, whatever.
Yeah.
And I think it's just I think that the support, like Georgia said, is the most important thing. Just being present. It doesn't,
Yeah.
And
you don't have
partners
to
want
fix all the
control.
problem.
Partners
Yeah.
want control
They
too. If
do,
you tell them
yeah.
what to do, they'd
I
be
know.
happy to do it. They feel helpful.
Exactly. What do you need from me now?
Yeah.
Yeah.
I know one of our head coaches has had a beautiful, she went through 13 rounds of IVF, countless miscarriages and losses, and had this beautiful notion of not acting like they were pregnant until they were pregnant, because for so many 2-week waits they were, and then they were crushed each time. And so they actually used that time to like go on vacations and do things that as a couple without kids, now they have 3, would want to do and not lose that time in doing. We've got one last question here. It's a quick one, I think. Best advice for a beginner, I believe this is what it says. Beginners scared to go through anesthesia for IVF.
It's
a
not
nice deep sleep.
Yeah.
Take it, Taraneh.
If you don't want it, I'll take it.
Yeah, exactly.
No, so I'll debunk it and not really call it like anesthesia. We have an anesthesiologist who's there for your egg retrieval to monitor you, make sure you're safe, make sure you're comfortable, make sure you're breathing, but you are breathing on your own. There's no tube down your throat.
Yeah.
There is, you're just sort of like taking a medicated nap. We give medications for anxiety to calm your nerves. We give some pain medications so that you don't feel uncomfortable. The purpose of the sedation that we're giving through the IV is to make your body relaxed so that we can safely place a needle through the vagina into the ovaries without any damage occurring. It is not because you need to be completely knocked out for this. It's just to make it safe. And since you are breathing on your own and you're completely monitored the entire time, it is very, very safe. To give you some perspective, at RMA of New York, we do this in an office building. We have a sort of ambulatory surgery center in an office building. And that is how safe it is, that we can do this procedure in an office setting, not in a hospital-based setting, and not with like a whole bunch of medical backup. So that's what I would say to just calm your nerves about it. It's not as scary as it seems, but like I said, for a lot of women, this is the first time they're even undergoing a procedure. So it just feels like all new and intimidating on the outset.
Thank you. Well, I think that is it for us. I want to first thank Taraneh and Georgia for joining. I jotted down tons of notes, and I consider myself an expert in this space, but now I have new frameworks and ways of thinking of things. I think we talked a lot about personalization and how one size does not fit all. If you're just getting started, I highly encourage you going to RMA of New York and getting a consultation. You can just learn a little bit about yourself. If you're a male, get that semen analysis. You can do it at home. You can do it in the clinic. If you need more, of course, come find us. You can use FF20 for a discount, a 20% discount on Conceive. But if you're an RMA of New York patient, this is included.
It's free.
No cost to you, which is incredible. So you get 24/7 support from Conceive trained nurses and coaches. Taraneh and Georgia, any parting words of wisdom? You've shared so much, and I'm really grateful for the time.
Oh, this has been great. And thank you all for listening and sticking with us to the end. And hopefully we can help you somehow in some way. My door's always open.
And please be as good to yourself as you're probably being to everybody else you love.
Oh, such an important lesson. Thank you so much. Thanks, Georgia. Thanks, Taraneh.
Hi, everyone.
Bye, guys.
Bye, everybody.